Daily headlines about war and global instability can be hard to handle. Stress and anxiety can build even as the conflict happens thousands of miles away. We are joined now by Dr. Shairi Turner, Chief Health Officer of the Crisis Text Line, with how people can manage fear and anxiety during times of uncertainty. Doctor, thank you for being with us this morning. We really need your advice. I mean, how does, seeing all these images of war impact our mental health?
Yes, thank you for having me. So images of death, destruction, people in distress can put us into fight or flight mode. And with these repetitive news cycles, it can make us feel unsafe, which activates our stress hormones and then really negatively affects our mental health and well-being.
And what are some common psychological effects if people are exposed to it for a long time?
So long-term exposure to distressing images, especially war-related content, can lead to chronic stress or secondary trauma, and people start to feel increased anxiety, irritability, trouble sleeping, difficulty concentrating, or some people just feel helpless or even numb. And it can really distort our perception, making us feel like the world is more dangerous than it actually is.
And doctor, do you know any healthy ways to stay informed without becoming overwhelmed or anxious?
So being informed doesn't mean being constantly exposed. So it's about intentional consumption, not passively scrolling, and choosing when, where, and how you're going to consume your news. Are you with other people? Try not to consume it at night, right before you go to bed, and decide whether digital versus audio versus video is the way that you'd like to consume your news, understanding that video is going to imprint more deeply in our minds. And lastly, listen to your body. So if you notice tension or stress or fatigue, it might be time to take a break.
And are certain groups more vulnerable to this kind of anxiety?
Yes, so we know younger people who are deeply immersed in social media and don't have the context of sort of the cycle of world trauma that we go through could be more deeply impacted, as well as those with existing mental health problems, depression, anxiety, trauma. Also, our veterans or people in the military who where these images might be triggering, and then just generally for those of us who are under, the day-to-day stress and overwhelm.
Doctor, thank you so much for joining us this morning and for all the advice. Dr. Turner is the Chief Health Officer for the Crisis Text Line. It's a nonprofit providing free 24/7 confidential text-based mental health support. Thank you.
Thank you.